Knock, knock. Knock the door. Sanitize my hands. Hello, my name is Pratik Chachan. I'm the FNP student for United States University. Today I'll be doing the mock exam on my patient. This assignment is just for my university purpose, not a real exam, and nothing will be treated over here. I'll be just doing a mock, and I have already uploaded the written consent from the patient, but I would also like to get a verbal consent from you to make this video, upload it in the YouTube as unlisted, and provide it so my faculty of the university can see and grade it. Is that okay with you?
Yes.
Thank you. I have also uploaded my ID card since we cannot wait for the YouTube. Also, I would like to let you know that today's exam is totally a mock exam. So if we find any abnormalities or anything abnormal on today's assessment, we will not be treating anything over here. You still have to go to your PCP, okay? And another thing today is like, I promise I will not use any external source or anything for making this video. Can I get your name is and date of birth, please?
My name is Vishal Chan. Date of birth is 8/29/1990, and I'm 33.
How do you define your race as? What is your race?
I'm Indian Asian.
Okay, Vishal, thank you. Why are you here today?
I'm here for my wellness check.
Okay. Is there anything specific you want to talk today?
No.
Okay. Patient is here for a wellness checkup. He does not have any specific concern, but if there is any specific concern, I will do a workup on that one. Like I will try to find out the onset, duration, location, severity, quality, timing, content, and then just work and see if there is any associated signs and symptoms regarding that. Before starting the video, I would like to do the integrity check. I would like to start with my ear check. There's nothing on my ear, no earbud or nothing. I just have watch in my hands. I'll use this as a timer. So I'll be setting up a timer once I'm done with the integrity check for my 1 hour, so I can keep a track of the time. And I am doing a 360 scan after this. So for a 360 scan, let me just rotate the camera. Just rotating like this. Then I'll be holding my iPad and showing over here what I have. So over here on my table, I just have things that are needed for my video. I have a paper for my brain dump. That's empty in front, empty in back. I'll just dump it in case I forget anything in the middle of the video and I can reference. That's the mirror I'll be doing. I don't know what is written, but that is nothing related to my assignment. It's a seat. Here's my patient. Christmas tree. Nothing over there. Nothing over there. Nothing in the ceiling. That's my chair where I'm keeping my iPad. Nothing there. That's the chair I'm sitting. Nothing on the chair. Nothing in the front chair. Nothing on the back of the chair. Okay. Camera here. Okay, can you get up so I can see if you can see the full body part? Okay, sounds good. I cannot see the knees, but for knees maybe we can go a little. Can you go a little further and see when I do my knees video? All the way down, all the way back. Go all the way back. Okay, that's fine. And get up. Okay, then come front for now. Go back for the lower extremities. Okay, now I'm gonna go ahead and do the meter check. So here is the meter check. Nothing on the left, nothing there on the right. Here. iPad, I don't know if it is visible there. Nothing, a bit of the iPad. There, it's the screen. There. Okay, I will make sure I just take the camera one more time, and then I'll start doing a brain dumping. Perfect. Thank you. Putting this here. Also putting a brain dump set here. Okay. I will put my things ready here. Everything is set up. There. Oops. Making my camera again. Sorry, I'm too having OCD. I messed up on my last video. I messed up the camera and didn't realize. Okay. Thank you for having a patience. Okay, we are starting our video now. I would like to start with your introduction again. Can you tell me your name?
Vishal Chan,
Your age?
33,
Your race?
Asian,
Your ethnicity?
Indian.
Okay, Your date of birth?
8/29/1990.
Okay. Okay, Mr. Now I'm gonna go ahead and start with the medical history. Do you have any chronic illness?
No.
No. Okay. When was the last time you had your doctor's appointment?
Last year.
Okay. When was your last dental visit?
3 months ago.
When was your last visual eye checkup?
Last year.
Okay. Did they find any issues on any of your visits?
No.
No. Okay. Do you have any concern for today's visit?
No.
Okay, he does not have any concern for today's visit, but if you have any concern, then I will do a workup on that one. I will do onset, location, severity, quality, context, involvement, and the sign, and we'll work on the duration, sign, and symptoms associated with the condition. Do you have allergy to any of the drugs, food, and the environment?
No.
He does not have allergy to any of the drug, food, and medication, but if he does, I will work up on the severity, what he is allergic to, and what kind of reaction does he get. Do you take any medication, including over-the-counter and supplements?
No.
He does not take any of the over-the-counter medication or any of the medication. If a patient is taking anything, I would like to know the name of the medication, dose of the medication, and how often they are taking, and what and is the medication being effective to the patient. Okay, and do you remember when you did your last testicular self-examination, or did you do it?
Yeah, last year.
Maybe last month.
Yeah, sorry, last month.
Testicular examination for the male patient, we usually ask self-testicular examination, which is done every month, and we usually prefer to do on the shower on the same day of a month, with a hot shower, soapy hands, and feel the testicles in between the finger. And if any abnormality is noted, we would just like to notify the provider for the further evaluation. And if it is a female patient, we will ask for the last menstrual date or last menstrual period. How does the period looks like, any cramping or not, last pap smear date, last mammogram, if the patient is pregnant or not, if she is pregnant, how far she is, and if she has any children, and the age of the children over there. And also we teach about self-breast examination, which is also done every month on the same day in the shower with the soapy hands, and just palpate the breast, and if any lumps noted, notify the provider for the further evaluation, because that can be a sign of something else, or again signs of cancers. So that was regarding the past medical history. So is that one? Do you have any mental health issues?
No.
Do you have any infectious disease like HIV, hepatitis, or AIDS? No. Okay. Have you had a surgery before?
No.
Any recent hospitalization or any record of being hospitalized?
No.
Okay, so here patient doesn't have surgery and hospitalized. If they do have, we'll want to know like what kind of surgery they had, did they went under any anesthesia, and what was the reaction for the anesthesia. Are you vaccinated for all your childhood vaccine?
Yes.
Or what about your immunization for flu and COVID? Are you up to date with them?
Yes.
Okay, thank you. And so we talk about allergy medication. Your health maintenance or sexual history. Are you sexually active?
Yes.
With one or multiple partner?
More.
Do you use any safety prevention? Like what do you use for safety?
Condom.
Okay. When was your last STD test?
Last year.
Okay, thank you. Can you talk a little louder? Sorry, I'm having a hard time hearing you.
Yeah.
I know it's like little late, but now I'm gonna go ahead and talk about the family history. Does any of your family has any medical history?
No.
Do you have your does your mom and dad has any medical history?
No.
Does your mom is your mom alive?
Yes.
Does she have any history?
No.
Any medical history?
No.
Is your dad alive?
Yes.
Does he have any medical history?
No.
Okay. Is your paternal grandfather alive?
No.
How old was he when he died?
76.
Do you know the cause of the death?
Natural.
Okay. Um, is your maternal grandfather alive?
No.
How old was he when he passed away?
80.
Okay. What was the cause of the death?
Also natural causes.
Okay. Does your paternal grandmother alive?
No.
How old was she when she was died?
77.
Okay. Do you know the reason behind, reason behind the death?
Also natural causes.
Okay. Now I'll go for the system and is your brother? Do you have any siblings?
Yes, I have one brother.
Does he have any medical history?
No.
Okay. Does he have any kids?
Does my brother have any kids?
No. Do you have any kids?
Yes, I have 2.
Okay. Do they have any medical history?
No.
Okay. Now I'm gonna go ahead and go for the systems, and I'll repeat. Let me know if they have any health history on any of those. Okay. For the ICENT, does any of your family has a glaucoma or cataract?
No.
Okay. For your cardiovascular, does any of your family has an angina or myocardial infection?
No.
For the neurological history, does any of your family member has stroke or syncope?
No.
Okay. For endocrine, does any of your family has a thyroid or diabetes or thyroid problems?
No.
Okay. For your GI issues, does any of your family has a diverticulitis or GRE?
No.
For GU, does any of your family members has benign prostate hyperplasia or any endometriosis or any uterine cancer or any?
No.
Okay. For for your pulmonary, does any of your family member has any asthma or pneumonia?
No.
Okay. For your MSK, does any of your family has any arthritis or any rheumatoid arthritis, osteoporosis or any?
No.
Okay. Does any of your family has a history of obesity?
No.
Okay. Does any of your family has a history of cancer, breast cancer, leukemia, skin cancer, any kind of cancer?
No.
Okay. Does any of your family has a bleeding disorder, hemophilia or anemia, any bleeding disorder?
No.
Okay. Does any of your family member has any mental health disorder like OCD, schizophrenia, or psychosis?
No.
Does any of your family member has a genetic disorder like Down syndrome or autism?
No.
Does any of your family has a history of substance abuse like excessive drinking, smoking, tobacco use, or illicit drug use?
No.
Does any of your family member has allergy to any of the food, medication, or the environment?
No.
Okay. Now I'm gonna go and do the same. Get your social history. Okay. When were you born? What is the place of your birth?
I was born in Portland, Oregon.
What is your nationality?
No, Asian.
Okay. Are you married?
Yes.
Do you have kids?
Yes.
Okay. How many kids do you have?
I have 2.
Okay. What is your occupation? What do you do for a living?
I own my own business. I work from home.
Okay. Have you ever served in military?
No.
Do you live in your house, your apartment? Where do you live?
I live in my house.
Is your house 1 story, 2 story?
My house is 2 stories.
Okay. Does it have a stairs?
Yes.
Do you have a safety rails on your stairs?
Yes.
Okay. For your habit, do you drink coffee? Any energy drink?
No, I don't drink either.
What's your diet look like?
I think I have a normal diet.
Huh?
I have a normal diet.
Okay, thank you. How many ounces of water do you drink a day?
How many ounces?
Yeah, or any cups. How many cups of
I'm
water?
gonna say probably 6 to 7 glasses.
Okay. Do you drink alcohol?
No.
Do you smoke tobacco?
No.
Do you do any illicit drugs?
Nope.
Okay. And what does your sleeping habit look like? Like how many hours a night do you sleep?
I'd say I sleep 6 to 8 hours.
Okay. Do you take anything for your sleep?
No.
Okay. What are your hobbies? Like what do you do in your leisure time?
I like to play sports and hang out with my family.
Okay. Do you feel safe in the house?
Yes.
Do you feel like you're having a problem of domestic violence or being abused in the house?
No.
Okay. Do you carry a gun?
No.
Okay. Do you drive?
Yes.
Okay. Do you wear seatbelt when you drive?
Yes.
Okay. So now I'm gonna go ahead and do the review of system again, but this is for you. So I'll just ask you if you have any problem on any of those area. Let me know if you have any. Okay. For your constitutional, do you have any fever, any pain, or any recent sudden weight loss or weight gain? Do you have any of those?
No.
Okay. For your eyes, do you have any change in vision, blurred vision, or tunnel vision?
No.
For ENT and mouth, do you have like hard time hearing, difficulty swallowing, sore throat, runny nose, any of those?
No.
Okay, for cardiovascular, do you have any chest pain, shortness of breath?
No.
For respiratory, do you have like difficulty breathing or cough?
No.
For GI, do you have like gastritis, diarrhea, or constipation?
No.
For GU, do you have painful urination or any discharges?
No.
For MSK, do you have any painful joint or swollen joint?
No.
For skin or breast, do you see any changes in your skin like rashes or nodules?
No.
For your breast, have you feel like any lymph nodes on your breast or any abnormalities
No.
like rashes, wounds, or anything?
Neither.
Okay, for your neuro, do you feel like dizzy or having unsteady gait?
No.
Okay, for endocrine, do you feel all of a sudden hot and sweaty and hot or sweaty or like any sudden weight loss or weight gain?
No.
Okay, for your mental health, do you feel having like depression, anxiety?
No.
Okay, for your lymph node, do you think you bleed easily or bruise easily?
No.
Okay, for your allergic, are you allergic to any food or any environment or any of the drugs?
I'm allergic to nothing.
Okay, now I'm gonna go ahead and do a general exam. For the general exam, like patients appear to be healthy, clean, no body odor, normal look, like no facial expression. Can you just stand up and walk? Okay, now come back. Steady gait, he's being able to walk normally. Do you know what day is today?
Today is December 17th.
Okay, who is the recent president of United States of America?
Joe Biden.
Okay, he's already oriented times 4. He knows who is the president of USA. So overall, the general examination looks fine. Do you remember your height? What is your height?
5'11".
What is your weight?
230 pounds.
Okay, so according to height and weight, his BMI is 33, which is little above the normal. So we can discuss about that in a little bit. And then for the vitals, I'm not gonna go ahead and do actual vitals over here. I'm just gonna verbalize. So for vitals, I'm gonna do the vitals on his both left and right arm, and then compare. So his vitals on right arm is 120/80, and the left arm is 132/80. And his pulse is 72. Heart rate is respiration is 16. Sorry, pulse and heart rate the same thing. Respiration is 16. SpO2 is 98 over room air. That was his vitals. Now I'm gonna go ahead. For the visual. So for the visual, I'm gonna do the external chart. So for the visual, can you cover your right eye and read the third line?
CJFET.
Okay, cover your other eye and read the same line.
CJFET.
Okay, then leave your both eye open eye and read the fourth line.
Fourth line. JLCTCF.
Okay, vision 20/20. He's able to see the things. Now I'm gonna go ahead and after that, after general, we're gonna do the skin, hair, and nails. I'm gonna sanitize my hands before I touch him again. For skin, is it skin? Yes. for the skin. For the inspection, skin looks moisturized, moisture, no rashes, symmetrical face, eyebrows are raised, no nodules, no papules, no pallor, no cyanosis, no swollen face, no jaundice, and no erythema. And for the turgor, skin turgor normal, no edema. Can I see your nails? No clubbing, no tar staining, capillary refill within 3 seconds. And while doing the inspection, like we'll see for the neve, we'll do A, B, C, D, E, which is A stands for asymmetrical, B is the border, C is the color, D is diameter, and E is involvement. So if any of those changes found in that A, B, C, D, E while doing a nevi, we should be concerning and go for the further evaluation. So that was for the inspection. And then for palpation, I'll be palpating the head. Head is symmetrical, no lymph node, any pain or tenderness while palpating. No, hair distribution is even, little bit thinning on the front, no dryness, no papules, no macules, no rashes, no open wounds. So that is for the, okay, now I'm gonna go ahead and do the, finish the face part. So I'll be doing the 12 cranial nerve. Get that out of my way. So first one will be the cranial number 1. Sorry, cranial number 1 is olfactory actually. For the olfactory, I will be doing a smell test. So I can see he's breathing normal. That means his both nares are open. So after that, I'm gonna see his nose, inside the nose, pink mucosa. He has a hair growth over there. No drainage, no discharges from the nose. No deviated nasal septum. So can you close one of your nares, close your eyes and tell me which smell. What is this?
Coffee.
Okay, and can you close your other nares and tell me what smell is this?
Cinnamon.
Okay, perfect, thank you. So that was cranial number 1, olfactory. Cranial number 2 is optic. So for that, I'll be starting with the visual. So we already did the visual while I was doing the physical thing, and his visual was 20 by 20. So so for the eye examination, we need to dim the light. I'm just verbalizing, we're not gonna dim the light over here. So I'm gonna see your eyes for inspection. For the while doing the inspection, note I didn't see any discharge, no discharge noted. Eyelashes looks normal. Sclera are white. No conjunctivitis. Now I'm gonna do direct and indirect pupil flight. That is direct and indirect. Direct. So people reacted equally to lights. So both direct and indirectly. Now I'm gonna go ahead and do the ophthalmoscopic exam. So no conjunctivitis, no redness in the eyes, no tearing eyes, no woolen spot. So I'm gonna do the ophthalmoscopic exam. So for that I'm gonna use right to right, left to left, using my hands for the safety. So I can see the red reflex. Cup to disc ratio is 1:3. Arteries, no dilated arteries and vein. I can see the sharp cup disc, sharp disc noted, and that was regarding the eyes. People reacted, and so we did that for the optic nerve. So cranial number 3 is oculomotor. Over here we're gonna do cranial number 3, 4, and 6 together, which is 3 is oculomotor, 4 is trochlear, and 6 is abducens. So for cranial number 3, we're gonna please follow me with my finger, okay? Only with the eyes. The patient was able to follow my finger everywhere. So 3 is other than medial, downward, and lateral. So and then while he was doing that, no nystagmus noted, and no like for the inspection, no stigma. no exophthalmos and ptosis. And while I was moving my finger, I can see no nystagmus. That was the cranial number 3. So cranial number 4 is medial and downward. So let's follow the finger down. Okay, and the cranial number 6 is lateral. Okay, so and then now I'm gonna do a conversion and accommodation. Just follow my finger. Okay, and oh no, I'm not gonna do that. I'm gonna do the confrontation. Okay, just keep following my finger. Okay, so the pupil was dilated while I was doing the finger. He was following me. I can see the pupil constricted and dilated. So that was cranial number 3, 4, and 6. Now for cranial number 5, which is trigeminal. So for the trigeminal, I'm gonna go both motor and sensory. So for now, I'm gonna palpate the temporal artery. So for palpating, let me know if you have any pain or tenderness. Noted. And then I'm gonna go ahead and do the TMJ tenderness. So for the TMJ tenderness, I'm gonna put my finger over here and tell patient to do open your mouth. Okay, and close. I did not hear any click sound. Plus, do you have any pain while opening the mouth? No. So he does not have any pain opening the mouth. Now I'm gonna do SARP and DAL for the cranial number 5. Can you close your eyes and let me know? I'm gonna do on forehead, cheek, and the jaw for the SARP and tell me if you SARP or DAL.
Do. Sharp. Sharp. Do.
Okay, so he was able to differentiate both the SARP and DAL. So that was regarding cranial number 5. So we did cranial number 6. For cranial number 7, so we're gonna see raise eyebrows, smile, puffy cheek. Okay, so he was able to do all of those 6. That was for the cranial number 7. I'm sorry, that was 7. Cranial number 8 is auditory. So for the auditory, I'm gonna go ahead and do whisper, waver, and Rene test. So for the whisper, let me know what I say again.
8, 10, 6.
Okay, usually for the waver test, we'll do from 2 feet apart, and patient was able to hear. So for the waver, let me know once you stop hearing, okay?
Stop hearing.
Were you able to hear equally on both sides?
Yes.
Thank you. And then for the Rene test, I'm gonna put it in behind the ear. Let me know once you stop hearing.
Stop hearing.
And now again.
Stop hearing.
Okay. So he was able to hear on ear conduction more than bone. So it's like ear conduction is more than the bone conduction. Now I'm gonna go ahead and do the otoscopic exam over here. So for the ear, I didn't see any discharge, no redness. Tympanic membrane pearl gray. I can see a little bit of wax over there, and the hair cone of the light is 5 o'clock. On the left side, no discharge, no redness. Tympanic membrane pearl gray, cone of the light at 7 o'clock. So that was cranial number 8, and then now cranial number 9 is a hypoglossal for the hypoglossal. So cranial number 9 is a glossopharyngeal. For the glossopharyngeal, can you just do lips are pink and moist. Soft palate are pink, no white spot, teeth no cavities, gums looks healthy, pink. Tonsils are on +2. Uvula midline, can you take your tongue out? Tongues are segmented, no pink, and no white patches on the tongues. So that was cranial number 9. Cranial number 10 is vagus, which we don't do. It is done for the gag reflex. So I'm not going to do a gag on the patient, but it is for gag. Cranial number 11 is a spinal accessory. So for the spinal accessory, I'll just sound you and you just don't let me do. Okay. And for the trapezius, okay, don't let me to do that. This side, don't let me to do that. Okay. So this was trapezius, and this was sternocleidomastoid mastoid tenderness. That is cranial number 11. So for the cranial number 12 is the hypoglossal. So for that one, can you just press your tongue on the other side? Thank you. I just need to use a piece of paper towel to blow my nose. Sorry. Okay, that was about your our cranial number, cranial nerves. So now I'm gonna go ahead and do the neck part. So for the neck part, I'm gonna start with the inspection. So neck, no rashes, no nodules, symmetrical, no enlargement. I'm gonna see the no deviated trachea over here, and now I'm gonna palpate the trachea for any deviation. No deviated trachea. Can you swallow? So while swallowing, no lymph node noted. I'm gonna feel the thyroid cartilage. So I'm gonna feel the thyroid cartilage, cricoid, and the trachea over here. So while I did that one, now I'm gonna do the lymph nodes. So I'll do pre-auricular and post-auricular. Pre-auricular, front of the ear. Post-auricular, back of the ear. And then occipital on the back. Let me know if you have any pain or tenderness while I'm palpating all this, okay? Occipital, no. And then anterior cervical, posterior cervical, supraclavicular, submandibular, and submental. So any pain or tenderness on any of those? No. Okay, let me see if I miss anything over here. Nerve system. Okay, so next we're gonna go ahead and do the thorax. For the lungs, would you mind taking off your shirt for the lungs? Thank you. So for the lungs, I'm gonna go ahead and do the inspection. So for the inspection, I can see the chest wall, no deformities. Our patient is breathing normally, normal breathing, no rapid breathing. The AP ratio is 1:2, symmetrical chest wall. Jeez, sorry from your body. Patient, the chest wall is symmetrical, and while palpating, I'm doing the chest expansion. So normal. Can you take a deep breath? Okay, so normal chest expansion. He does not have any chest wall deformities such as excavatum and carinatum. Jeez, I can never tell that word. And so he's thorax, no normal breathing, no rapid breathing. Now I'm gonna go ahead and do the palpate for the sternum. Let me know if you have any pain or tenderness while I'm palpating the sternum. No, any pain or tenderness?
No pain.
No pain, no tenderness. Okay. And I did for the chest expansion while he's taking a breathing. So normal for the appearance, normal. I did all those. Now I'm gonna go ahead and do. Can you sit over here actually, or just here? That's fine. Just here. No, little bit. And so yep. Okay. So now I'm gonna go ahead and do the tactile respiratory exertion. So for that, just 99 whenever I put my hands. Okay. Okay, thank you. Now I'm going to go ahead and do the diaphragmatic exertion. So for that, I'm going to put my hand on T10 and tell the patient to take a deep breath. Take a deep breath and exhale. Okay, so my thumb got expanded. That means like for the normal diaphragmatic, whenever the patient take an inhale, a breath, deep breath, and your thumbs got expanded. Now I'm going to go ahead and palpate the back, like lung field and the back, posterior part. Any pain or tenderness over there? No. No? Okay, now I'm gonna focus the lungs field for any resonance, and I'll do both symmetrically. I do all the 14 lungs field, and all of them are resonance. So that was respiratory exertion, diaphragmatic exertion, percus, tactile tremendous, and oops, sorry, I explained that as a so the with the thumb and the T10, it is a respiratory exertion whenever he is in case I think I said diaphragmatic. So for the diaphragmatic, what we're gonna do is we're gonna do both, compare both the side. So we're just gonna found the dull spot in between the ribs and just point the play, mark the point over there. And then from below we're gonna go up, and then again when we find the dull spot, just mark there and just measure them. So the measurement is 6 centimeters. The normal between two measurement is usually 6 to 12. So that is a diaphragmatic. So for the diaphragmatic exertion, we will compare both left and right. So we'll go percuss the thing, and then we'll found dull when patient is inhaling, and then we'll go from the down to the up, tell patient to exhale and hold, and then found the dull point, and then we'll measure those two. So that was for the diaphragmatic exertion, and then I'm gonna auscultate the lungs field on the back, and then we move to the front. Okay, no, no wheezing, no crackle, no ronchi. I feel like I didn't explain the diaphragmatic, so I'm gonna do it one more time. So while doing the diaphragmatic, we'll say patient to inhale and hold. Inhale and hold. Okay, so whenever you found a dull spot, mark over there, and then come from down, and then just tell the patient exhale and hold. Okay, and then mark that point, and then measure. So the diaphragmatic exertion will be the point between the inhalation and the exhalation, which is silent. Okay, confirm. So now I'm gonna do the anterior for the chest. Go back. Please, go back. So I'm gonna go ahead and do the tactile firmities over here. So 99.
99, 99, 99.
Okay. So I can feel the vibration on both sides of the thing. And now I'm gonna go ahead and do the respiratory exertion over here. Take a deep breath. Inhale. Exhale. So now the thumb got expanded, which is a normal over here. So we don't do diaphragmatic exertion in the front. I did that in the back. Now I'm gonna go ahead and do the percus, the long fields, and feel the resonance on the all long field, and we'll compare both left to right. Now I'm gonna go ahead and auscultate the long fields here. So no wheezing, no crackles, or no ronchi noted during the auscultation. That was all for the lungs. Posterior field diaphragmatic, yeah. So that is for the thing. Now we gonna go for the chest. So for the chest, for the inspection, no chest wall deformities, no redness, no tenderness. No redness, no chest deformities, no little bit of excessive hair growth. So that is for the. Then now I'm gonna go ahead and palpate the front chest for any pain or tenderness. Any pain or tenderness?
No.
No. Okay. So that was for the thing. The other one is. Now I'm gonna go ahead and do the auscultation on the lungs field, which the first one is, I'm gonna use both bell and diaphragm. So first one is aortic, which is on the right intercostal second sternum border. Pulmonic, which is second intercostal, left sternal border, arch point, third intercostal, left sternal border, tricuspid, fourth intercostal, left sternal border, and mitral valve, fifth intercostal, left sternal border. Now I'm gonna go ahead and do the bell, the same aortic, pulmonic, arcs, tricuspid, and bicuspid, mitral valve. So while doing that with the bell, we'll usually hear S1 and S2 sound. I heard the normal S1, S2, and while doing with the bell, I will go ahead and hear for any abnormal like S1, S3, S4 sound, which I did not hear any S3, S4 or any murmur of the heart. So that one, and the other one we're gonna do is a PMI, point of maximal impulse, which is left intercostal, fifth clavicular border. So for that one over here, or can you just lie down over there?
Lie down on my back.
Lie down on your back. Okay, let's make your head over there. Go up. Lift your leg. I'm gonna put the pillow under the leg so that will make my abdominal video easy. So I'm gonna do the same thing while he's sleeping. Aortic, right intercostal, second sternum border, pulmonic, left intercostal, second sternum border, arch point, third intercostal, third sternum, third intercostal border, tricuspid, fourth intercostal border, left sternum border, mitral, fifth intercostal border, left sternal border. And I'll be doing the both with the bell and the lung. So while I'm doing that, I'll also do the point of maximal impulse, just turn left. So the point of maximal impulse or the apex is in the fifth intercostal border mid-clavicular line. So while palpating, no pain, no, did you have any pain or tenderness? No. And no bruit, or while auscultating, no tree noted. So while I'm doing that, I'm going to go ahead and do the carotid pulse. So for the carotid pulse, I'm going to do one by one with both bell and diaphragm. And I'm going to palpate the carotid. I'm going to do one by one. For the, okay. So for carotid pulse, no bruit or no tree noted. So while he's lying down, I'm going to do the jugular vein distension. I'm not going to measure the JVD, just going to palpate it. Just look at the other side. And I can see the jugular vein over there. I can feel the pulse. So if we have to measure it, we'll just measure, but in this video, we don't need to measure it. Keep lying, okay? Chest expansion. Okay. Here. I did that one, inguinal. So I'm gonna go ahead and do the abdominal now. So for the abdominal, symmetrical abdomen, no hernia noted, no swelling noted, no ascites noted, a lot of hair growth. After palpating, like, okay, wait. After this one, I'm gonna do the auscultation first for the abdomen, and while doing, no sinuses noted and no jaundice noted. If in case we saw a yellowish tone on the stomach, we'd also like to see the sclera, because only yellowish of the abdomen can be the carotiditis. So to confirm the jaundice, we have to see both abdomen and the eyes. Now I'm gonna go ahead and do the auscultation of the abdomen. So I'll start with left lower, right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Both. No hypo or hyperactive bowel sound noted. So while I'm auscultating, I also like to auscultate the arteries. So I'm gonna go ahead and do the aortic artery, right above the umbilical, renal artery, no thrills, iliac arteries, femoral arteries. So for the femoral, I'll just do from the top of the thing. I'm not gonna go ahead and do we don't need to open up the clothes. I'm just gonna do and I'm gonna palpate the lymph node over here. Any pain or tenderness? No. So now I'm gonna go ahead and do the palpation of the abdomen. I will, I'll do the percussion of the abdomen first. So for the percussion, I'll start with the left lower, dull, left resonant sounds or a tympanic sound, left upper, right upper, left lower. So tympanic sound heard, which means no fluid noted, and on all 4 quadrants. So I'm gonna go ahead and do the percussion of the liver, and I'm gonna find the liver span. So for the liver span, we're gonna do in between the rib cage and find the dull point. So when we find the dull point over here, mark the point and then come from above the umbilicus and just find the dull point. So when you find another dull point, mark that and you need to measure those two. When measuring those two, it's like 6 centimeter, and usually the liver span is 6 to 12. That's a normal finding. Okay, so I'm gonna go ahead and do the percussion of the liver spleen here. While percussing the liver, dull sound, no dull sound heard over there. So liver, percussing the spleen. No, I can hear the dull sound over there. Now we're gonna go ahead and do the palpation. For palpation, I'm gonna do both light and deep palpation. So palpating the left lower quadrant for any pain, tenderness. I didn't note any hernia or any swollen lymph node. Now I'm gonna go ahead and palpate the liver. Not palpable. Spleen, not palpable. Now I'm gonna go ahead and do the deep palpation. Let me know if you have any pain or discomfort, okay? And I cannot palpate no tenderness, no hernia, and spleen and liver are not palpated. Now I'm gonna go ahead and palpate the bladder. No pain, no tenderness. Percuss the bladder, dull sound heard, which means he has a full bladder. And I'm gonna go ahead and palpate the kidney on the side of the back here. Can you turn more, please?
Yes.
Okay, I need more. So I can palpate the kidney on both sides over here. Not palpated. Okay, so palpated the kidney. Okay, lie down flat. So I'm gonna palpate the apical impulse and any palpable masses in the abdomen. So for the apical impulse, no bruit, no thrill, and no palpable mass, no hernias or no palpable mass noted over here. And then the another one I'm gonna do is femoral impulse, like femoral pulse over here. Feel the femoral pulse and the lymph node. And no lymph node noted. I can feel the femoral pulse over there. So that is so no hernia, femoral renal artery, percuss up forward, palpate, kidney back, aortic pulsation and pulsating mass. Okay, that is it for that one. Now we're gonna just get up and we're gonna do the spine. Just stand over there, turn back, bend down. So for the spine on the inspection, no scar, no rashes, no open wounds noted, no scoliosis, no lordosis, and no kyphosis noted. Okay, stand up. So while palpating of the spine, any pain or tenderness noted?
No.
Okay, no pain or no tenderness noted. And for the spinal ROM, just go bend down again, flexion, and bend back like this. Okay, flexion. Perfect, thank you. Now you can sit here, sit there, sit. And then for the cervical one, I already did the neck part, so you're just gonna do the cervical, no enlargement, no rashes, no swelling, etc. So for the anything. So for the ROM, just do flexion, down, extension, up, left lateral or right lateral. Okay, left, yeah, right lateral, and rotate your leg for the, okay. Perfect, thank you. So now I'm gonna go ahead and do the upper and lower extremities. For the upper, I'll start with the sensation first. I'll start with the inspection. For the hands, show me your hands. Up. No redness, no swelling, no no deformities noted on hands, waist. For the elbow, same thing, no redness, no swelling, no deformities noted. Shoulder, no redness, no swelling, no deformities noted. Close your eyes and let me know if you start at all.
Sharp, dull, low, sharp, sharp, dull, dull.
Okay, thank you. So I'm gonna go ahead and do the palpation of the finger. So for the palpation, I'm palpating any pain or tenderness on the joint while palpating. Okay, no. Any pain or tenderness on the wrist while palpating? No. I can palpate the radial pulse over here. So radial pulse, I can feel the pulse over there. Any pain or tenderness while palpating?
No.
I'm palpating the tennis elbow and the baseball elbow, like lateral and medial. Any while palpating the brachio or lymph node, triceps lymph node over here. Shoulder, any pain or tenderness?
No.
No, okay. So the pulse is the radial pulse I did, and then for ROM for the finger, just up. Okay. So for the finger, just make a fist. Okay. Adduction, abduction, adduction. Okay. For the finger strain, just don't let me press down. Don't let me press up. Okay. So for the wrist, flexion, extension, adduction, abduction. Okay. And then for the wrist, don't let me press down. Okay. For the elbow, flexion, extension, pronation, supination. Okay, then just do this. Don't let me push you. Don't let me pull you. For the shoulder, flexion, extension on the back. Okay, and then abduction, adduction, and then abduction on your. Okay, so stomp your shoulder. Don't let me push down. Okay. Perfect, thank you. So that was for the upper extremities. So for the upper extremities, I need to do the reflex. So for the reflex, I'm gonna do the brachial here and the tracheal over here, tibial here, and the radial. Okay. So that was for the pulses, and now I'm gonna go ahead and do the lower extremities. I'm gonna start with the inspection. I don't know if your feet are busy, but can you just sit over there? Just sit and put your feet here. Yeah, and put your feet here. Maybe. Oh, just here. And just sit like a squat. Just sit there and put the feet there. Yep. So for the inspection, no deformities, no swelling of the foot noted. Okay, and for the finger, just the flexion go down, flexion, extension, up, abduction, adduction, abduction, and adduction. Okay, and no cyanosis, no tire staining of the finger noted, capillary refill within 3 seconds. For your finger, show me the finger again. No cyanosis, no clubbing, no tire staining. I'm sorry, my throat is so bad. Capillary refill within 3 seconds. And for the feet, for the palpation, no deformities, any pain or tenderness?
No.
No pain or tenderness. Okay. And for the ankle, any pain or tenderness? While inspection, no swelling noted, no deformities. And for the ankle, rotation, up, down, adduction, abduction. And for the strength, don't let me push down. Don't let me pull down. Okay, and for your knees, for the inspection, no rashes, no deformities, no swelling noted. For the tenderness, any pain or tenderness? No pain or tenderness noted. And for the ROM, flexion, extension, adduction is like towards, and abduction is out. Okay, and I'll do the hip in a bit. For that, can you close your eyes and just let me know if it's sharp or dull?
Sharp, dull, dull, sharp, dull.
Okay, that was for the sharp and dull. And then now I'm gonna go ahead and do the pulse. So for the pulse, I'm gonna do the popliteal pulse, which is back of the knee, and then perial pulse. So perial tibius, like in the ankle, inside of the ankle, and perial mediasis on the front of the leg. So those are the 3 pulses we do. And for the reflexes, okay, just sit down. Yeah, okay, like that. For the radial reflexes, we do the tibial here. Okay, and we do, no, that's tibial, yeah, and the Babinski reflex over here. Okay, so that's the Babinski reflex and the tibial pulse. And for the hip, can you stand up for your hip? I'm not going to take off the clothes. Like again, no rashes, no deformities, no swelling noted, no lordosis, no kyphosis. And for the palpating the hip, any pain or tenderness?
No.
No. So okay, for the ROM of the hip, let me just slide down again. One more time, sorry. So for the flexion, take your leg up. Okay, that's the flexion. For the extension, turn back. Back on your
stomach?
Yeah. Okay, and then lift your leg up. That is the extension. Okay, and then again on your back. Lie on your back. Okay, so bend your knee. For your abduction, just there, adduction and abduction. So that was about your hip. Okay, I think I did everything. Thank you so much, Vishal, for letting me to do your assessment.